Now, Yuan, I know you're a Canadian doing us proud over in Oxford, so I know you follow Canadian developments very closely, and you've written about the subject of MAID. So I want to just start with the very big picture. What is your broad view on Canada's current experiment with medical assistance in dying?
I mean, I think the word experiment is right. It is an experiment, and it is an experiment which, frankly, has gone very wrong. Over the past 7 years, we have shown that we simply are not mature enough as a country to have legalized assisted suicide. In 2015, we were promised a very narrow, targeted regime which would only affect people who suffered from terminal illnesses and who were suffering from unbearable pain. From that very narrow conception of MAID, we have gone to a system which is one of the most, if not the most, liberal in the entire world. We now allow people to choose MAID for a very broad range of symptoms. We are going to allow people to choose MAID for psychological reasons from next year, and there's even talk of legalizing MAID for children. So I think it is a slippery slope, really, and we are very, very much sliding down very fast.
Interesting. Now, we could back up a little bit about, what is the rationale for having these types of laws in the first place? I mean, we are talking about ending lives. What is the general rationale for them? And is that rationale itself misplaced, or do you think that you mentioned narrow? Do you think it was just a matter of not putting narrow enough constraints around a more proper narrow conception?
I mean, that is one view. Certainly, we have done a very bad job at having constraints. However, I think it's the moment you legalize something like MAID, you are opening the door to expansionist arguments because of the nature of the justification which is used to justify MAID policies. Now, for instance, in 2015, when the laws against assisting suicide were challenged in Canadian courts, the Supreme Court of Canada said that banning people from assisting suicide was a violation of the right to life. The argument was that some people would want to commit suicide on their own terms, and they would be worried that they couldn't do it because of their physical condition, so they would commit suicide in a way before their time, and that this was a violation of the right to life. So this was a sort of slightly counterintuitive, twisted rationale, arguing that the right to die is a part of the right to life. And then, a few years later, Quebec courts decided that actually it was discriminatory to only limit MAID to people who are terminally ill, because the argument was there's a human right to end your life on any term that you choose, whether you have a terminal illness or not. So now we have a system which is much more open-ended, which doesn't really seem to have a very clear rationale except that of autonomy, but it's not very clear what we understand by autonomy, because we are increasingly seeing cases of people who make the choice, ostensibly who make the choice of dying by euthanasia, but who didn't really, in any meaningful sense, make that choice voluntarily. We have had examples, and I'm sure we're going to be discussing them, of people who have been more or less coerced by the system, by our healthcare system, by our bureaucrats, by our economic system, into choosing MAID. So really, the original rationale was basically compassion and freedom of choice, but now it's anything else, really.
Interesting. And so I take it your view is that you really, once you establish that there is essentially a right to death, if you make that conception too narrow, you're going to see exactly what we've seen in courts, which is you can't put constraints on that, or you're discriminating against people's ability to exercise their right to death.
Exactly. And I think one of the factors which really made a big difference here is that Canada has a very heightened culture of rights discourse. We talk in terms of charter, we talk in terms of human rights very, very naturally. And in most cases, that is good. But in the case of MAID, that has led to a unwarranted and unanticipated expansion of the regime, so that abuses have been taking place all over the country.
Interesting, and troubling in a lot of ways. I certainly want to get into some of the examples, maybe after the break, on the slippery slope. You mentioned earlier on that we are definitely sliding down that slope, and I think a lot of those cases are things that many Canadians would find disconcerting if they're even aware of them at all. So.